So I'm doing the workout for a 60-year-old Jerry. She has arthritis, and because of her disease, she has multiple joint issues that restrict her movement, as well as range of motion issues, and she has pain in her wrist, lower back, knees, and shoulders. She wants a weight training program for 2 other days per week, as opposed to her yoga classes she takes 1 day per week, and she's at the beginner level stage. So because she's at the beginner level stage and she has a lot of range of motion issues, we want to first give her like a proper warm-up so she can gradually over time build up that range of motion to take off some of the stiffness that is caused by the arthritis in her muscles, as well as to give less tension on the joints and the ligaments around the muscle. That way she'll be able to perform her exercises more effectively and efficiently. So for starters, if you have a towel or a resistance band, I don't have a resistance band with me, but you can take a towel, fold it in half, have the client lay on something soft or sit in something soft for that matter. I have a yoga mat right here since she does yoga. For her to stretch out, she could stretch out her hamstrings by putting her foot on the middle of the towel, holding both sides of the towel evenly. She would then sit with her posture straight, her back straight, her shoulders up. She would then gradually pull the towel towards her and start to gently lean back. She was on her back and pull the toes down, back toward the body like as a dorsal flexion, until her range of motion is that she is feeling it. You don't want to push her too far because you don't want to have her stretch past her range of motion. You just want to help her develop that range of motion. You can also have her come out to the side. If she needs help, you can, as a client, stand next to her and assist her foot so she stays stable and balanced, or hold her hip so she doesn't roll completely past her range of motion. You do it to both sides. Next, you can roll the ankle out. Have her roll the ankle out. Get that nice rotation while putting a little bit of tension, so that way she can keep increasing her range of motion. If some days are, for people who have arthritis, it's harder on certain days for them to have range of motion, but over time they'll start to notice that their muscles are becoming more flexible and they'll get higher flexibility. You can also do this to many parts of the body. You can also do it to the back. Have them put the towel, grabbing both ends of the towel and stretching, reaching back to really flex out that back issue that she has, but just don't make sure she's not going too far. She wants to stay straight. You can support her by holding her back or having her lean against a little bit of a wall or like something with a supporting structure so she can really stretch out that muscle. She can also go widthwise as well. Stretch out some of the shoulders, some of the joints back in her back. Come back in, and then stretch out again. Once she does that, she can move on to more of the weightlifting stuff. So for starters, the first thing that you can have them start off by doing, you can have them do things. First, I would have them warm up by doing exercises in a chair, since she has a little bit of that range of motion issues and that arthritis. Have her start in a seated position, and you can have her practicing doing chair dips. So you have the client stick their legs straight out in front of them with a little bit of a bend in the knee. Have them try and keep their feet close together. Have them keep their elbows in line with a 90-degree angle, and have their posture straight with their chest out and their shoulders back, and have them use their triceps and the lower half of their legs to push themselves up. So you'd have them perform it like this, and then you'd have them go back down, have them do it again. again, and then come back down. This chair is a little bit wider for me. Obviously, you'd have them use a little bit of a more narrow chair. That would help them. I just don't have that right now. So, again, have them do that for about 10 to 12 times. Have them do maybe two sets. Make sure that they are breathing out on the way up and inhaling on the way down, exhaling on the way up, and inhaling on the way down. Next, we can add a weight sequence to that. So they could use either a 5, a 2.5. I think a 5 would be okay for them. Due to the fact that she has a little bit of foot issues, we want to see how much weight she can actually use to start off with. So you can have the client start in a seated position, and you can have them keep the weights close to their side with the same posture, feet relatively shoulder width apart, their chest out, shoulders back, good firm posture, and have them really driving up with the lower half of that posterior chain and come up. If they can't immediately get up from that position, have them start in a standing position, and then you can hand them the weights. If they need you to hand them the weights, make sure that their posture is straight up, and then have them really stay straight, shoulder width apart, and come down to the range of motion that they can, and come back up. As a client, you can assist them, or as a personal trainer, you can assist them by either standing on the side of them or behind them to help push them up a little bit and give them a little bit of extra assistance. So you perform a few of these, and so on. The next phase that you can have them do, you can have them start in a seated position and have them really work on their shoulders. If they can't lift the full range of motion, that's okay. It's important to note that there's different types of angles that are affected from the shoulder joint. So if they have more stiffness in certain parts of their joints, you can change the angle of the shoulder to adjust for them to perform the exercise. So if you could zoom in on this right here, like you could just come closer. So my shoulder, if I'm coming up this way, you're gonna notice there's a little bit more tension in this area of the shoulder, whereas opposed to if I come out to this area, it changes the angle a little bit of the shoulder and the tension is being changed a little bit. You can have them perform raises going straight out and straight down. Also out on an angle, like as if you were going for a wide position, or a T raise where you're coming from down here and coming straight up, coming down and straight up. That way they can hit each part of the angle of the joint and also work on making the muscles around each part stronger. The next part would be to have them perform either, they could do this standing, preferably standing. If they can't, have them sit, as she does have a foot issue. She can perform bicep curls with the weights. She should have her elbows close in tight to her ribs, to her body, her posture straight back, and have her really focus on slowly bringing the weight up and then slowly lowering it back down. Make sure that they are exhaling on the way up and inhaling on the way down. Inhaling on the concentric phase and inhaling on the way down, exhaling on the way up, inhaling on the way down. I'm sorry. All right, and then the next part that we can do would be just a standard, whether they have to do this sitting down or standing up. Typically, you could have them do this also against the wall for extra support. You can have them lean up against the wall and have them lower down with the weight, and come back up, lower down, and come back up. That way they have a little bit of extra support for her lower back to keep her back stable so she's not fully relying on her stability, especially with her lower back issues. You would do it alternating each way. Have them do that about 10 to 12 times. Assist them from the side of them and make sure that you're guiding the weight with them and making sure that their form and their back stay straight. And then finally, there's last two exercises we would do. 10 minutes. Would be either you could have them doing a standing chest fly or a sitting chest fly. Have them start out and bring the weight close together as far as the range of the motion allows them to go. If they can only go here, that's fine. Just make sure that they're contracting the muscles and make sure that they're bringing the weight together and keeping the arms straight with the posture and chest out and the shoulders back. You want to exhale on the concentric phase, inhale on the eccentric phase. And so on. And then finally, the last exercise we would do would be a tricep kickback. So you can have them lean up against the wall or even a chair. It's probably easier for them to use a chair. So have them lean up against the chair. Have them rest the weight next to their hip. You want to maintain your elbow and your arm about at a 90-degree angle. Use the other arm to support on the chair and let them use their knee, the right knee, slightly in front of them, slightly bent, and a little bend in the knee and the back leg as well. And you just want to focus on contracting the tricep. You don't want to swing the arm fully. You want to just hold that position and just lengthen the tricep, contract the tricep, lengthen. Just nice, slow, and controlled. And you want to breathe out on the way out and breathe in on the way forward. And then you would obviously switch and do it to the opposite arm. And so on. And then as for a cool down and the recovery process, you would basically perform either active stretching or active cool down or static stretching just to loosen up any of the muscles that may feel a little bit tight. The workout should take them approximately like 30-35 minutes. Since she's at the beginner level, 30 minutes of exercise is probably enough for her. And we need to increase that range of motion for the first initial weeks so she can get that flexibility and relieve some of that muscle stiffness and some of that tension that's around the joints and the ligaments and the tendons. So it's essential that she performs those types of range of motion exercises that we did in the beginning of the warm-up, probably about twice a day, just so she can keep increasing that range of motion and become more flexible for her workouts to make it more easy and efficient for her. So that would be just a standard workout for an arthritis patient, about 60 years old. Frequency of about probably 2 times per week. If she's able to go up to 3, then so be it. But we'd have to build that up with relatively low intensity to moderate intensity. So thanks for watching. Have a good day.